Good morning. I'm Don Walker. I'm Communications Director for Brevard County Government. This is our 16th bi-weekly update Facebook Live event updating our residents on the COVID-19 pandemic. And our panel today is Maria Stahl, who is the Administrator for Florida Department of Health Brevard, John Scott, who is the Emergency Management Director, Matt Wallace, our Public Safety Director. We have Catherine Allen from Brevard Public Schools, and also Jessie Ray, who handles social media for Brevard County. She'll be asking us some of your questions that you pose during our updates. So I'm going to turn it over to Maria Stahl for an update on the pandemic. Maria?
Hi, good morning, everyone. I'm Maria Stahl, the Administrator at the Health Department here in Brevard County. Our cases, current to date cases of COVID-19 is 31,582. We added 156 cases today. Our positivity rate for today was 5.85%. Overall, since the beginning, we're at a 13.39% positivity rate. Unfortunately, we did add 5 additional deaths today, so we are up to 690 deaths. The one thing, as I've said before, I want to reiterate, it's important to look more at the trend and not at one specific day. So I'll report out the last 2-week trend. Our median age has been in the 40s. We've had between 128 and 323 cases per day. Our positivity range has gone from 5.80% to 11.27%, and the overall positivity for the last 2 weeks is 7.2%. Over the last 2 weeks, we've also added 63 deaths. So as I say that, it is, COVID-19 is still in our community. It is still important that we continue with our mitigation measures, and that is face coverings, social distancing, avoiding large crowds, washing hands, and staying home when you're sick. I'll move over to the vaccine side of the house, which is giving us light at the end of the tunnel, but not time yet to stop all our mitigation. Current to date, we've done 60,548 doses of the COVID-19 vaccine, and this is everyone in Brevard County, and 41,583 first dose or complete doses. And to give a percentage of the population over 65 that has been done, 24% of our population in Brevard County is over the age of 65. Of those over the age of 65, 32% have been vaccinated. Again, as I know John is going to relate a little bit more, again, the issue is supply of vaccine. As we get supplies, we're giving the vaccine. We don't not have lingering doses more than a week. We get them, we give them. So thank you, and I'll hand it over to John.
John, before we go to you, though, I just want to get Maria, correct me if I'm wrong. So you said we've had 60,548 doses administered in Brevard County, and of those, 41,583 you said were complete doses, meaning they got both doses.
Correct.
Okay.
Correct.
And 32% of those eligible in Brevard County to have been vaccinated are
32% of those over the age of 65 have been vaccinated. The other ones that we're vaccinating are the frontline healthcare workers. So that is in the number of doses. It's not obviously in the percentage over 65. And the hospitals have gotten some doses where they can vaccinate per the governor's executive order. They can vaccinate those under the age of 65 that have comorbidities that would make them at high risk for contracting COVID-19.
All right, thank you,
Not
Maria.
contracting, but having adverse outcomes of COVID-19.
All right, and John, please pardon the interruption, but I just wanted to get some clarification from Maria on that. So if you would provide us more details.
Sure, Don, thank you. Good morning, everyone. My name is John Scott. I'm the Emergency Management Director. I will build off of what Maria and Don just discussed, just to talk about our vaccine operations. A couple of things that are positive. I know there's still a lot of angst and frustration and anxiety in our community with the vaccinations, and we get it. Supply is that limiting factor, but we are making incremental progress to it. So we chip away at it every week. And this week we got a little bit of good news, and that the federal government turned on the federal retail pharmacy program. So in addition to including all of the Publixes, which we currently or previously had as part of our effort, we also got Walmart, Sam's Club, and Winn-Dixie. Now, that's not all stores, and I'll come back to them here in a minute, but those are additional partners, opportunities to get vaccines for our residents and more shots into our community. I'll talk about ways in which you can sign up for vaccines. What are the current options? So there's our primary site, which is at the Viera Health Department. We had been previously using Eventbrite to help do that, to schedule appointments. 2 weeks ago, Friday, we transferred to the state's system. It's a pre-registration system. It's called ShareCare. The way that state system works, it is 100% a pre-registration, so you sign up to essentially get in line. And then as new appointments are made available, they will contact each individual on the list based on the number of appointments they have, and then schedule them to come get an appointment at the Viera Health Department. There are a couple ways, and Logan, if you could put the information for ShareCare on the line, that's it right there. You can get in line on myvaccineflorida.com or myvaccine.florida.com. .gov. I can't read today. Or for those who don't have access or are not technologically savvy, there is the phone number, which is on your screen as well, that they can do. Again, you get in line, and then you wait for appointments to come available. As of this morning, we had 35,322 folks signed up on the ShareCare system to receive their vaccine. And at that number, with the small level of doses we get, which is which has been about 1,500 for the last couple of weeks, it will take us some time to get through that list. But we talked about Publix. Publix has been on board for a while now. It's at 22 stores in Brevard County. You can go on Publix's website and sign up for a vaccine that way. We also, again, part of the federal retail pharmacy program, we added one Sam's Club, which is in Cocoa. So Logan, if we can start to show those websites on how to do that. Thanks. So we added one Sam's Club, which is in Cocoa. We added 3 Walmarts, which are in Melbourne off of Wickham. We added Winn-Dixie in Malabar, or off Malabar Road in Palm Bay, and Winn-Dixie down in Mico. Again, with all the Publixes, and on your screen shows you how to go on there and sign up, create accounts, and make appointments. To manage everyone's expectation with that, doses are still low. Supply is still limited. So we cannot accommodate everyone's need there, but those are 4, or I guess if you do the math, that's 6 new opportunities and 6 new places to get vaccines in the county. So we're really, really excited about that, and we have every assurance from the federal government that as supply increases, more stores will be added. I think it's a great continued step as we try to chip away at the vaccination need here. Maria talked about it. We have light at the end of the tunnel. We also understand everyone's anxiety. We understand everyone's access. We're trying to identify new and creative ways to get out to the community where we can in very targeted and specific ways. But we don't have the supply to do it on any sort of scale that I think folks are looking for and hoping for. Now, we know that Johnson & Johnson this past Thursday applied for their emergency use authorization. That's the big step in getting authorized and approved by the FDA. It usually takes between 2 and 3 weeks for them to go through the approval process. Johnson & Johnson is 1 shot, so that's an added benefit there. The big benefit is we're going to have another vaccine manufacturer in the marketplace getting shots out. Like with other ones, supply will be limited to start with as they scale up production, but we continue to make progress. I know it may not be at the speed that we would all like, but it is progress nonetheless. So please hang in there with us. Continue to be vigilant. As Maria talked about, COVID is in our community. We need to make sure that we're practicing all of our good countermeasures, that we're wearing face coverings, that we're practicing good hand hygiene, that we're implementing social distancing, and that we're avoiding large crowds. If we can do that and continue to increase our vaccine supply, even if it's just a little bit every week. That is going to be how we get out of this. So we thank you for hanging in there with us and know that we will get through this together. Don?
Thank you, John. Our Public Safety Director, Matt Wallace, is also here today for an update, so I will turn it over to Matt.
Thank you, Don. And thank you, Brevard County, again for tuning in to us. I didn't realize this was our 16th Facebook update. I think that's fantastic as we continue to try to get the word out to the citizens of Brevard County so you can make appropriate plans and do things that are in best interest of you, your family, and your loved ones. From a county perspective of what we're doing to fight COVID is, if you've been tuning into the commission meetings, we now have the capacity from county government to do about 18,000 shots a week. That John Scott has been talking about earlier, and Maria did too, is the supply is obviously the issue. But if we can do, the 18,000, if we had that supply, the 35,000 folks or so that we have on the share care list, we could knock those out in 2 weeks. But it is the supply problem. The capacity to put shots in arms is there. It's the supply of the vaccines that we're running up against as the issue. So please know that your county government, we're working hard to make sure we continue to increase that capacity to put shots in arms. We are waiting for the federal and the state authorities, again, to open up those supplies and get those supplies to us. And you do have our pledge that once those get flowing, not only from a county perspective, but also the private partners that John has put up there across the county, we'll be able to have a lot of vaccines going in arms on a weekly basis. So patience is the key that John continued to talk about. This is a marathon. This is not a sprint. In marathons, you do sprint at times to keep up with the pack or get ahead, but it's a long race. And we've been at this race since March, which is quite a long time ago. And if you think about when we first started talking about vaccines and getting that process into place and putting those into arms, we're only in about the 6th week of doing vaccines. So when you talk about a monumental effort across this entire country and this state and this county, we're only 6 weeks into the vaccine process. And to be where we are and to put the numbers that Maria talked about earlier and to put the processes, the partners, the relationships, the contracts, the logistics that it took to get us to where we are in these last 6 weeks. I mean, it is a monumental effort of where we've come from where we are starting back at the part of January, even around Christmas. So please, if nothing else out of today, understand it's a supply issue. Your county government is working extremely hard to make sure that we support you and have the ability to put shots in arms when they become available, and we will absolutely support all we can. One thing we talked about before we went on air too a little bit is there's also other vaccine opportunities across the county other than the Walmarts and the Publixes and other than our vaccination sites that we're running through the county. The federal programs, if you're a military veteran over the age of 65, please contact the VA. They have a supply source. As other federal programs across Brevard County at the military bases and if you're associated with those. So if you are in those special categories, please use those opportunities as well. Again, the thing that we're trying to do the best we can is to get ahead of this curve and put shots in arms as quickly as we can. Please thank you for your patience and continued patience. We will get through this, as John says. We will get to that better place as we continue to make that incremental progress. As long as we get time behind us and we have that future ahead of us, what the plan is and how to get there, we will make it. So please hang with us. Don, thank you. That's all I have.
All right, thank you, Matt. Catherine Allen handles communications for Brevard Public Schools, and she is here today to provide an update. Catherine?
Thanks, Don. Again, my name is Catherine Allen with the Department of Government Community Relations for Brevard Public Schools. We're pleased to report that our numbers have been trending down. We're finally back on kind of a trajectory where we were prior to holiday break. So we're pleased to see that backing down those case numbers and those quarantines. Really want to say thank you to our schools, our staff, our families that continue to do great jobs with the mitigation efforts, face masks, social distancing, good hand hygiene. We really appreciate just the efforts that it's taking for everybody to come together and do what we can to help control the spread in our schools. We do want to take just a quick moment and remind everyone that school is in session on Monday, President's Day. So yes, we have school. That's been something that we've been getting asked a lot, and that changed due to the calendar starting the school year 2 weeks late. So if anybody has any questions, they can certainly check our website at brevardschools.org and click on calendar. And that's all we have.
All right, thank you, Catherine. I wanted to briefly mention that since the pandemic began, Brevard County has put millions of dollars into the community to help small businesses that have suffered through the pandemic. We've provided rental and mortgage assistance to folks who have lost their jobs. We've also had food stability programs where we've provided food for folks, and also personal protection equipment. We've also handed out thousands of gloves and masks to businesses and to our residents. As of later this week, we will be implementing a new rental assistance program using $18 million that we've received from the federal government. We will be posting the details on that program on our website and also social media, including Facebook and Twitter. So please be on the lookout for that. If you need assistance, there is assistance there. Any types of assistance you need, you can also call 211, and they can help get you in the right direction to an agency or a county office that can help you. With that, I'm going to turn it over to Jesse Ray, our social media specialist. Hopefully, we've gotten some questions that we might be able to answer today. Jesse, what do you have?
Yeah, thanks, Don. So I do have a couple of questions. How do you expect the vaccine supplies coming to Brevard County to be affected by the additional venues that have been established through the federal program, such as Walmart, Sam's Clubs, and Winn-Dixie stores?
So I'll take that one. I'm going to answer it two ways. If the question is, do I think we're going to see an increased number of vaccines coming in the county? Yes. Yes, I do. Those specific pharmacies are getting supplied directly from the federal government and does not impact the state's allocation. If the second part of that is, do I think it's going to impact what we're getting right now at the health department from the state, we have been told no. We have been told, again, it's a separate pool of vaccines that's coming straight from the federal government, and it should not impact how the state does its allocation.
Excellent. Thank you. Also, considering the number of people who have pre-registered on the state site for the vaccine appointments, what is your estimate for when the 65-plus age group who want a vaccine will be accommodated and the vaccine will be opened up for other ages and categories? And who do you think might be next?
So I'm going to take it in two parts. One, when do we think we'll get through the list? Tough to forecast that because we are seeing, again, more partners added, incremental shot numbers coming in. So if we start to see that in 5 or 10,000 more into the state of Florida, or 20,000 more in the state of Florida, does that get passed down to here? That kind of thing changes every week. What we focus on, what we can control, is how fast we get whatever we get out, and we continue to be able to do that sort of so that we're down to 0 new first shots every week. And you heard Matt talk about the idea that we've got all ready to go capacity to spin up for another 18,000 shots. So all we need is the supply to get us there. I can't say when we're going to get additional supply and what that looks like. As far as other groups, expanding beyond our 65 and older and our healthcare workers with direct patient contact, that I can't speculate on. That is, at the end of the day, a governor's decision. He sets the priorities for how we go forward. I would hope that we're getting more vaccine and that allows us to expand. I really hope that's the trigger that drives everything, but it's hard to say when that's going to be there. Again, it all ties back to supply. I know I'm a broken record on this subject, but it is supply, supply, supply.
Okay, thank you. All right, so Maria, overall, are our numbers trending downward, do you think?
I just looked at that report. I can tell you the month of January was the highest that we have had all along. In the month of January, we had over 7,000 cases. Back in July, we thought that was a high month, and that was 5,000 cases. So January definitely was our top. From all indications so far, the first couple weeks of February, is it is coming down a little bit. We were averaging 300 to 400 cases a day. Now we're averaging more about around 200. So we are seeing a slight decrease over the last couple weeks, but I can tell you January was definitely our top month of all time.
Excellent. Thank you. Well, not excellent, but thank you for your answer. So when there are no shows, are those vaccine doses wasted?
We don't waste any vaccines at all here in Brevard County. And I can actually tell you, we do not have a no-show rate. We actually have the opposite, where people show up that don't have appointments that we do have to turn away. We are very, very careful with drawing up our vaccines, and we do not draw up more vaccines than we have people there. So we actually do counts. You know, when we get close to the end of the day, we actually do counts of how many people we have, and that's how many we draw up. So we do not waste any doses.
Perfect. Have we found any variants here in Brevard County? We're hearing a lot about these variants.
Right now, the state does have a report. There's 5 identified variants here in Brevard County. I want everyone to know, with the variants, the mitigation measures are exactly the same as they were COVID-19. So there's nothing more that can be done. The variants that we have seen here in Brevard County are the UK variants. And there's a couple caveats I wanted to mention on that. Is not every single lab is tested for variants. It's a random sample that is tested for variants. Also, the rapid test is not going to identify a variant. It's just going to identify a positive COVID-19. So there truly is a possibility that there is more than 5, but there has been 5 identified.
Okay. John, we've heard about the state site and getting on the state site. So what happens? I've registered, I'm on the state site, I'm in the wait list, and then I'm able to get a vaccine through Publix. Is there a way for me to get my name off of the wait list so that I can make room for other people?
Yeah, so there's 2 ways to do it. And again, one, thank you for being responsible and wanting to make sure you let the systems know that you are indeed vaccinated. You can call back the same health line you register and let them know, hey, I have been vaccinated, you can take me off your list. That's the most proactive way to do it. The second piece is, of course, when they call you, just let them know you've already been vaccinated. But certainly if you've got the initiative, we love it.
Okay, excellent, thank you. This will be my last question that I'm going to take, and then we'll put the slides up with all the information again, because I know a lot of people are asking for that. So I'm going to word this in a certain way. How do we here at Brevard County decide what groups and priorities get vaccinated?
We follow the governor's directive. I mean, it is that simple.
Excellent. Okay, thank you. All right, so Logan, could you do me a favor? Could you put up the Share Care slides? So for those who want to register through the state, there's your website, myvaccine.fl.gov, or you can call 866-201-5420. For the other ways to get vaccinated, there are the other 4 locations that we've mentioned. So that was my promise to you, to put those slides up again. Don, that's all the questions I have for today.
Yeah, and I think we'll leave those slides up, Logan. We're gonna end it on that note and leave that up there to give people ample time to write those down. We appreciate everybody tuning in. We'll be back in 2 weeks, and please follow CDC recommendations and stay safe. Thank you for joining us.